Hello friends, today we are going to study Kent's 12 observation. Lecture number 35, prognosis after observing the action of the remedy in Kent's philosophy. What is prognosis? Prognosis is a Greek word meaning to know before. It means forecasting, especially the course of disease. The first prescription is the most important decision made in homeopathy. The follow-up prescription is very likely the most difficult prescription. The Kent's 12 observation, also known as remedy reaction, means narration between patient and doctor. The second prescription demands more knowledge, more sensitivity, and more judgment. During the second prescription, we must inquire about how does the patient feel in general. Has the degree of energy been affected? Has there been any change in physical chief complaint? What about mental and emotional plane? Is there an appearance of new and old symptoms? Okay, what is aggravation? There is aggravation means patient feels worsening of his condition, and amelioration means relief to the patient and he feels better. It is a practical topic. Lectures on homeopathic philosophy by Dr.Tejashri. Prognosis means to know before or a forecasting, especially the course of disease. Okay, these are the reactions seen in any patient. Okay, the source of this topic is from Kent's medical practices. He had given examples of every observation. It means forecasting, especially of the course of disease. Prognosis can be made by closely observing the changes in the state of patient after a prescription has been made. The prognosis can only be made if medicine was homeopathic and it has acted. Okay, this is very important point. The second prescription means the first prescription has acted, then we have given a second remedy, that is a second prescription. So let's study the first observation. This observation in your lifetime you will rarely see. A prolonged aggravation and final decline of the patient. Prolonged aggravation, the aggravation which is long lasting, prolonged, and final decline of patient, and after that prolonged aggravation the patient is declined. Here the Kent has given the example of a patient. A stoop shoulder patient is suffering from hacking cough for many years. He is lean, anxious, and careworn. His face is sickly. He is poor and gets insufficient scanty meal. Has violent aggravation after a few days. No relief at the end of 2 weeks or even a month. He gets worse and worse as a day go by and gets no relief. Finally, he is bedridden. Okay. Here the example of this tuberculosis case given in a Kent's philosophy. What is inference of this case? Here the Kent has given the deep acting remedy. The antisoric was too deep and it has established the destruction. Next, the vital reaction is impossible in this state. The patient is already careworn, lean, anxious, and the case was an incurable one because the patient came very late to the Kent. Okay, his pathology is now incurable pathology. The destructive changes in organs has happened. High potency, disproportionately higher than the susceptibility. Here the potency has given which is very high. In incurable cases, what to do? The prognosis is unfavorable because there is a final decline of patient. Here death may occur in this type of cases. Unfavorable cure in such a case cannot be guaranteed, even if the potency had been lower. If we wait with a placebo under these circumstances, the condition will go on deteriorating gradually. What to do? Medicine should be antidoted. You have to antidote the medicine, because here is a prolonged aggravation. The medicinal aggravation occurs. So we have to antidote first. After recase taking, a more similar medicine in lower potency is to be prescribed. The lower potency is very important. High potency should never be used in a chronic and doubtful cases. In incurable cases, the cases with organic changes go for a low potency. If this cases, the 50 millisiemal potency has to be very much effective. It has become possible to cure cases otherwise thought to be incurable. Okay, Dr. S.P. Day. Nowadays, most of the cases and most of the advanced pathological cases, the 50 millisiemal potency is prescribed. Okay, like hemophilia cases, cancer cases, acquired autoimmune diseases. Next, the second observation, long aggravation but a final and slow improvement. Okay, here the case is the same as under the first observation. Kent has described the same case with this difference that if at the end of few weeks, the first observation में क्या देखा था, there is a final decline, but in a second observation he is a little better and his symptoms are little better than when he took the dose. There is some hope that finally the symptoms may have an outward manifestation whereby he will attain a final recovery, but for many years it may along with a prolonged aggravation. Means in a first observation there is a prolonged aggravation and final decline. That means that's a killer aggravation. The pathology is advanced. But in a second observation there is a long aggravation but final and slow improvement. Means this is a borderline case. Okay, the borderline aggravation. The pathology is not that much advanced like a first observation. Okay, there is a marked tissue changes in some organ but has not gone into the incurable stage. Okay, inference shows the beginning of some marked tissue change in some organ. The state of tissue can be understood. We can make out the prognosis of the case. What to do in this type of cases? Do not disturb the action of dose. Okay, same as the first observation. If the pathology is getting advanced, then you have to antidote or recast, give the lower potencies. Understand? Okay. Next observation. Third observation. The aggravation is quick, short and strong with a rapid improvement of the patient. This is the ideal homeopathic aggravation. Quick, short and strong with a rapid improvement of patient. When there is a quick, short and strong aggravation, means your amelioration or a relief to the patient is a long lasting. Okay. What is inference? In the vigorous and robust constitution, you can observe this type of observation. When there is no tendency to structural changes in the vital organs, the improvement will be marked. Here there is only the functional changes occur in an organ, or there is no structural changes in the organ. What to do? Here is curable. The patient is in curable state. He is his constitution is vigorous, his vitality is very strong. What to do? Do not disturb the action of dose, because this is the homeopathic aggravation. In the case of perfect similimum, a slight aggravation of symptoms occurs in the first hours after the remedy in an acute sickness and for the first few days in case of chronic sickness. Here I want to give you example of an acute case. Okay, a person is suffering from headache from exposure to the sun. He is bursting in nature and the head feels too large, better by movement. He is given a natrum carb 200 and after taking the medicine his headache increases in intensity after an hour, but he feels better in 1.5 hours. His headache is gone. Okay, this is homeopathic aggravation in acute case. Next example, in a chronic case, the patient has a pain in a right hypochondrium, better by very hot drink and hot milk. He is given chelidonium 1 mg. His symptoms are worse for the next few days and then he is relieved the pain. Okay, understand? The reaction of vital force in this case is strong. The remedy is well chosen and patient will cure soon. Thank you, friends.